The signs are all there, with fires raging around the world.
So you've probably seen these urgent news reports about climate change. It's a hot topic, pun intended. But what do these news outlets often not touch on? The answer is something so important yet under discussed, the role of future medical professionals, or you and I, in climate change. And so as avid students, we are on the front lines of this battle, whether we realize it or not. And so I'm Jamie Lim, and I'll be talking about CO2 to you, how future medical professionals are crucial in this era of climate change. But before we dive into the 1.5 degrees Celsius limit and the alarming rise in natural emissions, let me introduce myself. And so I am a rising junior, a resident of Torrance, California, a student at the California Academy of Math and Science, and an avid student researcher who's been fixated on combining the mechanical nature of engineering with the more theoretical basis of biology. And so nothing excites me more than debate, where I've been serving as a captain at my school under the LA Metropolitan Debate League. I also was involved in HOSA and studied pathophysiology. Being the chief editor of my school newspaper for the class of 2026 was a fun pastime for me, and I work in CAD at a two-time world qualifying team, FRC 687 as well. I also explored AI and software at journalism last year in USC Annenberg, and I spend my free time volunteering as the treasurer of CSF, as well as competing in Cyber Patriots. But most importantly to me, I am involved in biophysics research at a local college, CSUDH, and that led me to realize how important and powerful our generation can be in science. And so interviewing researchers at USC last year was initially what captivated me into the field of medicine, hence my project in AI and human psychology. I took this interest and started as a student researcher at Think Neuro, and I started an opioid project on its crisis there. And I also started a project in pulmonary hypertension at Columbia and volunteer at the UCLA Children's Hospital. As a student researcher at CSUDH as well, I've learned to integrate machine learning, physics, and coding into the study of life. Now, into the inherency, or what is happening right now. So it's 2024, meaning it's been exactly 200 years since Joseph Fourier discovered that Earth's atmosphere acts as an insulating blanket trapping heat. This concept is known today as the greenhouse effect, and it laid the foundation for our modern understanding of climate. And so this set the stage where a basic understanding of greenhouse gases appeared early on. And more specifically, we can think of Earth's atmosphere as a blanket that wraps around Earth. And this blanket is made of gases like carbon dioxide and methane and water vapor. And so the Earth's surface then radiates heat back towards space in the form of infrared radiation. And the greenhouse gases here absorb some of this infrared radiation and then re-radiate it back in all directions, including back towards the Earth's surface. And so this trapped heat keeps our planet warm. And this is a greenhouse effect that is essentially causing Earth to warm. But this is also where the issue rises, because after the Industrial Revolution, human activities added non-natural source of greenhouse gases, and this brought 2023 to the hottest recorded year in the planet. And so this is what we find. 35% of US heat deaths are due to climate change, and those who are older and have color are twice as likely to die. And the heat is causing deaths and preventable deaths, where we, future medical professionals, enter the picture. And so, see, climate change isn't an environmental issue, it's a public health crisis, from increased respiratory diseases, heat deaths, and vector-borne diseases like malaria that just increase with heat. The health impacts of climate change are impending. And we see these results in a medical field. Namely, this case study shows an elderly victim of a heat stroke, with his risk factors being older, having a history of hypertension and heart disease, and living in a poorly ventilated apartment. He shows symptoms of central nervous system dysfunction from his slurred speech and fast heat. As future workers in medicine, we will see more patients with such conditions. And we will also see that many of these climate-related illnesses linked with lung cancer from air pollution. And from biomass burning and industrial practices, sulfur oxides are released, and particulate matter is also released from burning practically anything. And today's widespread air fresheners and aerosols release many volatile organic compounds. And we can see that the size of a single particulate compound is less than 2.5 nanometers, easily getting stuck in or clogging our lungs. And so we see how urgent climate change is in the health and well-being of human populations. See, health itself transcends just disease. Rising sea levels have caused mass relocations, and heat stroke has caused deaths of workers. Diseases have become wider spread, and so have deserts, actually. Food prices have rose, and disease spreads very fast in the heat. Even further, we can actually see that agricultural productivity has weakened, and water is slowly getting more polluted as well. And so, what can we do about this as future medical professionals? A lot, actually. First and most importantly, we must educate. Climate change is a global issue, and global efforts are the only way to tackle it. We can do this easily with newsletters, writing, simple conversations, even through social media to our just friends and family. Educating others early on as a future medical professional is bound to evoke lifestyle changes, an increase in awareness of climate issues, and even invite teamwork when others may share your sentiments. Next, we must advocate for policies. We can pre-register to vote even if we're not of age yet, or collaborate with student-led initiatives for the environment, and take action in our community, whether it's to volunteer or simply just voice our support to environmentally cautious policies. Lastly, and arguably most importantly, we can learn to make a direct footprint early. From professionals, we can ask our own questions and make an impact in over-emitting today. The most powerful initiative is tackling the issue by learning about it and finding real-world solutions to it, to the pit of the problem, actually. So namely, Unite Students, a UK provider of student accommodation, has surveyed 1,000 UK undergrads to find out more about their views on the climate crisis. And they found that students themselves are taking initiative in limiting their flights, supporting policies and people who voice climate activism, and basing their career plans around the future of climate change. Many of these students are concerned and doing their own personal studies to help out on this global issue. And as a professor I learned under at CSUDH stated, children are the best scientists because they aren't afraid to explore what they're curious about. In this way, we can take the matter into our own hands and engross ourselves into the topic to bring solutions today. Here are my references, and I would like to express my thanks to the Global Health Leaders Conference for inspiring me to speak on an issue that I am truly passionate in and giving me an opportunity to spread awareness to students like myself. I am also grateful to the various environmental and health organizations I have researched for this presentation, whose research and resources have provided a solid foundation for this work, such as the United Students Initiative, and for referencing their study. And lastly, for referencing Professor Krogman of CSUDH's quote about students being brilliant scientists, I would like to acknowledge him for inspiring not only me, but all his students. So thank you so much for listening, and please feel free to reach out anytime.